going to examine the respiratory system examination. Good morning, Shalu. Hi, I am Dr. Patnaik. Can I examine you? Thank you. So that's the first step. While examining the respiratory system, this is the best position because as the 45 degree, the bed is propped up for a 45 degree. Right? So what are the other things you have to look for? Whether the patient is anemic. So what are we looking for in the tongue? Whether there is a cyanosis. Examination of an wood nail. What's called? Clubbing. Lift the arm up to your eye level and you can let the low down yourself and then look at the finger clubbing this way. Right? So at the same time you can ask the patient to keep your fingers like this. Right? And what can you see? You can see a diamond shaped hole between two nail curvature. So that is your nails are normal. You have to look for the flapping trend. Right? So when you put your thumb and the wrist back, and you have to come and examine the ankle edema also. Keep your thumb and press over the lateral, the medial malleolus for a few seconds and see whether there is any pitting edema. Now then the next thing is you check the respiratory rate. How do you check the respiratory rate? You need your wristwatch, you look at it, and then when you are checking the respiratory rate, right, you have to distract the patient. We are pretending that we are checking the pulse rate. Right? So you have to count for at least 15 seconds. Under inspection, first you have to come to the foot end of the bed. This is called the foot end, that's called the head end. What are the things you inspect? First thing is whether the patient is in the comfortable or not. That's the first thing, right? And then at the same time, as you are examining, look for the symmetry of the chest. So you can come here or here. So you have to see the either side. You have to compare. Sometimes you can see there is a pectus excavatum and the carinatum. Then you have to see for whether there are any scars. This next step is palpation. Feel the trachea from above downward, and while keeping the two fingers either side and compare whether this trachea is deviated or not. Chest expansion. How do you check the expansion? You have to pull the keep your palm over the chest, right here, and ask. This is a midline, right? And you have to look for the movements of the thumb. Movements of the tongue and whether it's whether symmetrical or asymmetrical. So you start here. Can you take a deep breath in and out, Charlie? Can you see the movement of my thumb? So it's come together and moving away. That is the upper part of the chest. How do you check the lower part? So that is you have to use and hold the chest like this, right? So this is the lower zone of the chest. Can you do it again, please, for me? Earlier, there was a thing called vocal fremitus, but in current clinical practice, we are not much entertained about the vocal fremitus, right? What is vocal fremitus? We ask the patient to say 99, right? Or Sinhalese, you can say 99 කියලා කියන්න. Or 111, right? Right. So then you are keeping your arms, the ulnar border of the arm, like this, and see whether there is any difference. That's called vocal fremitus. Right? Can you say 99? 99. Right? So then for the percussion, what are we have to use two fingers. This finger, right, percussing finger, and then we have to bend it for the 90 degree, and then you have to keep the palm over the chest, and except the middle finger, all other fingers should lift up. Right. So how to percuss the apex area? Then you take the little bit in, and so you start here, this tree area. Right here in the middle and in the innermost. Then you just tap over the apex, and then keep your middle finger not over the bone, intercostal space. Usually we don't keep things over the ribs, right? Right. So then you just tap twice, right? 1, 2. This sound is resonant, right? And you compare this side, right? And then go down next intercostal space and compare. Then when it come to here, so this percussion should go like this, because you have to avoid here the cardiac heart is there, right? So then the percussion ideally when it is coming down should spread out to lateral, and this side resonant, 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 and then auscultation. For the auscultation, right? Auscultation, you have to use your stethoscope, right? Stethoscope, and then keep your stethoscope and lift it up to the 90 degree, right? The 90 degree, not like this, and the 90 degree, and ask the patient to take a deep breath in and out. Charlie, can you take a deep breath in and out for me? Vocal resonant is the most important thing. Vocal resonant is the most important thing, right? So now, Shalu, say 99 when I'm pressing, when I'm keeping my stethoscope. So inspection, remember that the most important thing again, the scars. So what you have to look for, again the scars, right? And then any the deformities, scars you have to look for, and then you have to look for the palpation of the lymph node. Start from, use your both arm. This is how to palpate the lymph node, and then here you start here, and this is and come this way, and come to the posterior auricular, and then posterior triangle lymph node, and go to here, and then you can you, so then when the head is tilted to the right side, and this muscle will be relaxed, and palpate whether there is any lymph node over this space called what? Supraclavicular fossa, right? Again then we will go for another the 4 steps. What are now the palpation, under palpation, the chest expansion. So take again deep breath. So it's nicely moving. So upper part, and how to palpate see the chest expansion in the lower part, right? So you have to use your both palm and keep hold like this, and keep in the midline and see what's the movement, right? So can you see that it's nicely moving, right? So nicely moving either side equally, right? So that is chest expansion, right? The percussion again, when you are percuss, can you keep your arm crossed like this, right? Right? So that is why we are asked to keep the patient to keep arm crossed against the hand, so scapula to move away. You just keep your still, right? So here, this side. This is resonant. Here. Right. So keep over the intercostal space. Right. And then auscultation. Auscultation, first we look for the breath sound. Right? Asked to take a deep breath in, out. Look for the vesicular breathing. Or whatever. Take deep breath in and out, shall we? And then last one is vocal resonance, right? So you can say ask to 111 or 99, whichever you prefer. So can you say 111? Finally, you have to thanks. Right. Thank you very much, Shalu, for your kind cooperation.